The senator from North Dakota.
Mr. President, one of the things that the health care law changes here has demonstrated is that partisanship in Congress has reached a new height, or I would say a new low. I'm tired about reading about who's to blame for what, and I know Americans and North Dakotans are too. Most importantly, it certainly doesn't do anything to help American family health care get any better. We should all want to improve our health care system so it works better for families and for businesses. It shouldn't be a bipartisan. It should be a bipartisan discussion, not a political exercise. I'm here, as are many of my colleagues, because that's what we hope to accomplish. For years, I've been offering reasonable reforms to make the current health reform law work better. I want such reforms to be bipartisan. I want to have a larger conversation about health care in this country. But the Republican Senate bill, or the Better Care Reconciliation Act, is simply not the way to have those discussions. Frankly, this bill is a non-starter. I've heard from so many North Dakota children with disabilities, seniors in nursing homes, men and women with pre-existing conditions in my state, and hospitals, doctors, and nurses, especially in rural communities, who are deeply concerned. In fact, I could tell you deeply panicked about how this bill would make care less available and less affordable. But there are real common sense actions we can and should take right now to make sure American families aren't hurt in the near term. That's why we're here today. Action and uncertainty caused by the administration, as well as House Republicans, exacerbated instability in the insurance markets, threatening significant cost increases for consumers in 2018. The administration's been unwilling to commit funding for cost-sharing reduction payments, and some Republicans have been working to dismantle the health reform law by not funding critical reinsurance programs. These actions make it extraordinarily difficult for insurers to plan and make business decisions for 2018. Yes, 2018, the year that we're talking about today. If insurers can't rely on these funds to support health care programs, which make it possible for health insurance costs to remain affordable for families, the health insurance premium filings for the next term year will reflect that uncertainty. And health insurance rates for 2018 that have already been filed in some of our states demonstrate that fact. So let's talk about the facts. Independent reports from the Congressional Budget Office and Standard & Poor's have said that the insurance markets were expected to stabilize this year and could stabilize this year unless the administration causes disruption. If you look at the numbers from last year, you'll see that health plans were offered in every county in this country. Today, we're here to offer a few bills that will make an immediate and real difference for families to address health insurance rate increases that we expect in 2018. These are common sense bills that should be bipartisan. We hope our colleagues across the aisle will work with us in a bipartisan way so we can provide immediate relief and guarantee stability for the individual market. Stability which will enable individuals and families in all of our states to avoid serious increases in their health insurance rates. No family should face bankruptcy to cover their health care costs because in Washington, D.C., we can't implement the bill that we have, and instead we continue to stall out and play the game of politics against the interest of the American people, and certainly in many cases some of the most, the sickest among us and the people who have a whole lot of health care insecurity. This is politics. We cannot continue to play politics with people's health. Some of the issues we're working to address were included in the Senate, interestingly enough, the Senate health care bill. A clear acknowledgement from the Republicans that these changes are necessary for the health market to function in 2018. Right now, we are standing here because time is of the essence, and I hope our colleagues will join us in this effort. We want to work with them. We hope they will work with us. We hope that we can, at least at a minimum, get together and solve the problem for 18 while we're debating the future of healthcare delivery in this country. And so I'm going to start out and call on my friend, the great senator from New Hampshire, Senator Jeanne Shaheen, to offer what I think is a terrific idea and to talk about a bill that I'm a co-sponsor on.
Mr. President.